we get that fluid in, please, now?
Peter, open your eye.
A level 1 trauma is really major trauma. Something that's putting the patient at immediate danger of dying.
Can you call, please contact me?
The pelvis has been damaged at the front.
Major trauma centres where all the specialties are available on site to deal with major traumatic injuries. It's a one-stop shop.
You've got someone who 1 minute was fit and healthy and the next second is injured or dying.
It's that sliding doors moment. Maybe if something had just been a little bit different, their lives wouldn't have been changed forever. When we're looking at level 1 trauma, we're anticipating not just single body parts being injured, but usually multiple body parts. So a major head injury and a major chest injury, or a chest injury and a pelvis injury. So without an immediate intervention from us, there's a chance that patient won't survive.
Harry had everything going through. Significant head injury, possible chest injury, possible abdominal injury, pelvic injury and leg injuries. He was unstable, he was tachycardic, his pulse was racing, and he'd already received blood en route to hospital, which is unusual and again raises the stakes of, you know, this kid is really, really sick.
Right, can everybody just listen up just for a minute? Okay, so we're expecting a 9-year-old in polytrauma. We'll get more details as they arrive. I hope to do a handover, so I want absolute silence when that happens. Top end, do you have drugs ready to keep this child asleep?
For a lot of colleagues in the department, it's highly emotionally charged when it's a child. The trauma team is much bigger when it's a child as well.
Hi guys.
Hello, fire away. Everyone listen up, please.
Hi everyone, this is Harry. Harry is 9 years old. Harry stepped out into a road and has been hit at high speed by a high-performance motorcycle approximately 1 hour ago. He was knocked unconscious. Injuries top to toe. He has a right closed head injury. He has bruising to his left chest and left abdomen with suspicion of pelvic and splenic injuries. He has a closed
answered the phone. Hello, it was my mum's husband. He said, woman, Harry had a really bad accident. Can you come quickly? I rushed up there, got out of the car. My little boy was on the road, laying in a pool of his own blood with a big hole in his leg, screaming, From that moment on, I felt like somebody had pulled my heart out.
Could we have 340 mils of blood straight in through the Belmont, please? No, because there's a fractured femur above it. Duncan, from a ventilation point of view, PCO2 of 5.07. OK, can we get that fluid in, please, now?
When Harry came in, my first concern was that he looked like he had potentially life-threatening hemorrhage, and we really weren't sure where that was coming from, and that was a difficult moment. What we needed to do was establish more intravenous access quickly, and that was really difficult with Harry because he was cold and he was what we call shut down.
If you have significant injuries and you've lost some blood, your body will start to compensate in a way by saying, I'm not going to shunt the blood all the way around this body. I'm going to begin to shut down some parts of the body so that I concentrate the blood centrally to the brain, to the vital organs, to preserve them. And that's why you don't feel a peripheral pulse.
Is there a pulse in the neck?
We've not been able to measure a blood pressure yet. I think we should go to CT. Reason being is if he's got a big mass of blood in his head that needs sorting, got potential loss from pelvis and femur. Let's try and keep him as warm as we can.
Sorry, what was it?
5.5.
Then please, sea level scan.
Can actual contact CDU1, please? Thank you. Can actual contact CDU1, please? Thank you.
before he went for his brain scan, I was praying to God that he wouldn't have a head injury. I had my near-death car crash, which has changed my life massively. Minor brain injury, and I was a victim, my worst enemy.
We wanted him in the CT scanner as quickly as possible because we knew that he had a definite head injury, because we could see that because he had bruising and swelling around his eyes. It did make us think, could he be bleeding into his brain?
Breathe in and hold your breath. Breathe normally.
If you've got something bleeding away in your brain, your head is a closed box. There's only so much extra space could be accommodated before actually your brain gets forced down through the bottom of your skull and it's game over.
When Peter started to paraglide, of course you do worry about the risks it carries, but at the same time I could see what utter joy he got from doing it.
You alright, mate? You conscious, mate? Don't move, don't move. Don't move. Ambulance, please, as quick as possible. Yeah, might need an air ambulance, quick as possible, please.
Where's the near Clapfield? Top end of Waterloo there. Yes, right. Thanks, Rich.
Got a paraglider who has hit the ground, his boots failed. We don't have any injuries yet, so we'll find out when we get there a bit more. But he's in the middle of nowhere. It's quite hilly around there as well, so access might be a bit difficult.
They're waving, aren't they? Yes, they are. Where is he? If you look down the slope, you've got a red object halfway down the slope. Oh, visual, yes. Okay.
Once we flew past the initial scene, we could see that the patient was still on the side of the hill and there were people with him.
What I'm probably going to do is leave you here.
Peter, the patient, was on his side. He was actually in considerable pain, but that was good for us because it identified that he was conscious.
It wasn't up now, complaining of pains and stitches from his hips.
His chute had failed, probably about 20 to 30 feet plus from the actual site that he'd landed, so the impact was quite significant.
Sorry to cut your clothing off, my darling. Well done. Yeah.
Pain in my chest, right here.
Yeah.
Pain in your chest.
I need to just get a blood pressure, yeah.
And couldn't see any catastrophic hemorrhage externally, but Peter was losing blood somewhere internally because his blood pressure was so low and he was very pale.
Right, Peter, as soon as what we're going to do is, because your blood pressure is a little bit low at the moment, we're going to give you some IV paracetamol.
Please, sorry.
He was very seriously injured. We knew the condition would probably deteriorate quite quickly if he wasn't taken direct to the trauma centre.
Then Peter, we're going to move you down the hill, all right? Okay? Ready, brace, lift. It is absolutely shocking when only 3 hours ago you were making the pasta sauce for dinner and suddenly your beloved is in a critical state. I remember being very, very frightened indeed, and very worried about Peter. Yeah.
It's 3 days since Peter's paraglider wing collapsed and he plummeted 30 feet to the ground. He was airlifted to the Major Trauma Centre at Southampton General Hospital. He's now in intensive care, sedated and breathing through a ventilator.
The intensive care unit is where we look after the sickest patients in the hospital, where we can provide life support. When Peter was admitted, initial scanning showed that most of his injuries are thorax, so chest, sternum and broken ribs. Most importantly, he's had quite a lot of injury to his vertebral column. So he's broken some of the bones in the cervical, thoracic and lumbar areas of his spine.
Did you just see the roll?
Jill was very nice and very gentle, but I don't think you can really cushion that blow that says Peter's had a paragliding accident. I mean, how is this not going to be serious? And she said, he's alive, and I thought, oh my God, if alive is the good news, then the injuries cannot be insignificant.
We met on holiday 8 years ago, became friends and started writing to each other. A few months later, Peter came to visit me and stayed. So we've been together ever since. How are you doing, love? How are you doing? Bernadette and I were in intensive care.
You're nice and deep asleep now.
Everything seemed fine, but suddenly things began to change. He was getting whiter and whiter. He began to perspire and became very agitated and distressed.
You just keep your hands down.
Peter.
Well done.
Peter, you're very safe. You're in hospital. Do you remember you need to stay nice and still for me?
It was really very frightening because clearly something was going on and was changing his condition very rapidly.
Hi there. It's all right. Just keep your hands down. It's okay there. Keep your arms down.
Peter, try not to bite the tube. Peter, open your eyes.
Peter damaged his ribs and he punctured one of his lungs, so air was caught between the chest wall and the lung. And that space of air gets bigger and bigger and bigger, and it presses on the heart. And so you can rapidly progress to a cardiac arrest situation, and it's life-threatening. It needs to be treated. It can kill you. And the way to treat it is to let the air out by making a hole in the chest.
At one stage, I remember actually lying down on the waiting room floor thinking, I don't think Peter's going to get through this. He looked so bad. I don't think he's going to come back.
Have we organised an urgent chest x-ray?
Can you ring X-ray, please?
As soon as you let the gas out of the chest again, that then allows blood to get back to the heart in a normal way. And then once that was resolved, his oxygenation came up very quickly, his blood pressure came up very quickly.
It's better.
Okay, there we go, so pressure's come up, see? All settles.
You could tell them things are good at one point and then they change completely in seconds. No one is ever out of the woods here until they, leave.
Any agenda beyond getting through these few days no longer exists. If we can keep our beloved Peter alive and with us, the rest we will work out. We just worry about now, about getting through this.
"4 hours after 9-year-old Harry was hit by a high-speed motorbike, a CT scan has revealed there is no brain damage. But the full extent of Harry's multiple injuries are still unknown. He's being transferred to paediatric intensive care.
Now, okay.
Let's just have a little look. And we've got a blood pressure that we're monitoring at the moment. Here. Okay. can you speak to the surgeons? Left femur, right open tib fib.
When he got into intensive care, there were parts when I wasn't too sure. I thought he was over. Honestly, I thought.
I can't tell them whether their child's going to survive or not. I can't tell them whether they're going to have life-changing injuries. And I suppose that's probably the most difficult thing, because almost always we just don't know in the beginning.
Harry's case is not unusual for the trauma centre. Every month, Southampton General Hospital receives around 50 major trauma cases. The vast majority are aged under 40 and have been involved in road traffic accidents. Shannon has just been admitted.
This is a 19-year-old woman who's been hit by a car, and she's hit her head against the windscreen, bullseyeing it, so shattering the glass, but complaining mainly of a pelvic injury. Kate, could you do a quick fast scan looking at both her abdomen and her chest, just to check there's no obvious causes of hypotension that would mean we go to theatre and not CT scan? And once we've got those two things combined, we'll head to scan.
Overall, approximately 8 to 10% of people die with a pelvic fracture. There's lots of structures that can bleed. There's your reproductive systems, you've got parts of your bowel in there, you've got your bladder in there, so there's nerves. These structures, they have a very rich supply of blood. Now, if you have a pelvic fracture, any one of these can be damaged and they can bleed. That's what we're stopping. We're all standing around the patient, and everyone's interest is to stop a patient bleeding to death.
We'll be ready to go in about 5 minutes. Suspicious of an injury there, aren't you? I mean, it's sore, isn't it? Okay. There is always the chance that she could have a head injury as well, something going on around the brain or a bleed around the brain. And we've got to be careful about her spine because of the way in which she's hit the car. But the key here is her pelvis. So Simon's one of our orthopaedic surgeons. We'll have a pretty quick look at the films. It'll give us a really good idea of what's happening.
Can I just see the posterior elements?
On the axle?
Yeah, so there's an alar fracture. Okay. The pelvis has been damaged at the front and also at the back in this area here. So this is the sacrum. And there's a lot of big blood vessels around here, and you can bleed in a catastrophic manner. She's exquisitely tender over there. So we just need to have a closer look with the pelvic surgeons if they want this stabilised now.
Yeah, she's a bit sleepy, isn't she? A phone call from the woman who was at the roadside. She said, "Are you Dad?" Yeah. I went, "Yeah." She went, "Oh, Shannon's had a bit of an accident." Just raced over him. I could see the air ambulance in the air over the bridge, and I was like, "Oh, worst feeling in the world."
She's literally just finished work, got off the bus, went across the road to go and pick her car up.
Yeah.
That's when someone knocked her down. I think she was one step of getting onto the pavement when this person knocked her over.
We've just got the doctors looking at your pictures, and they will tell us as soon as they've gone through them step by step to see if you... I haven't seen them, sweetheart. I haven't seen the pictures, okay?
What we think has happened is she's seen the car coming, and rather than it hitting her front on, we think that she's turned to her side, and it's called a lateral compression injury, and the initial force has gone through this area here, breaking her pubic bones. Both of them, you've got two on the right hand side, and both of them have been broken. Now there's this nasty little spike of bone that's gone very close to her bladder.
Her and her boyfriend were going off to Tunisia tomorrow, and I'm afraid that won't be happening, bless her. She's absolutely gutted.
I thought she may not walk again. The pelvis is like one of the hardest bones to break in your body, and I thought, she's broken that in 2 places. You know, this is serious. I mean, your spine's connected to it. What if something's happened with her spine? She may be paralysed from the waist down, and they may not know that yet. And it was just that period of waiting between resus and op that I'll never forget.
Shannon has suffered a fractured pelvis, which is a very severe injury. Only people who are involved in high-energy accidents fracture their pelvis. What we're going to do is give her pelvic stability. So if you think of it in its simplest terms, the pelvis is like a round polo mint. You can't break a polo mint in one place. If it breaks in one place, it will break in the other. So what we're going to do is fix the pelvis from the front and the back.
The extent of her injuries that she had to have done was such a worry. So you were just crazy with all the thoughts that were going on in your head.
Everyone's knee-jerk reaction is, I don't want to have surgery. We would like to try and treat everything without operations if we could, but we need to operate on people to improve their outcome. I know that 3 or 4 patients, when they came in with severe life-threatening pelvic injuries, they didn't want surgery because they hadn't registered the severity of their injury, and it was very much up to me to explain what's going to happen if they don't have surgery. They may never walk again, they may have chronic pain, they may have disability in the future. This is the bone of the pelvis, and you can just see here, this is the broken part at the front here. So I've got this bone lever in here which is levering this in the right place. We're going to put a plate across from here under there to put the fracture back together. When Shannon does decide to have children, she'll have to have a caesarean section because the pelvis expands during childbirth, and we're putting plates and screws to prevent that expansion. Be a bit careful there, mate, doing that.
So the 38, please.
An invaluable tool in orthopaedic surgery is the use of X-ray. It allows us to ensure the metalwork is in the right place, and in particular the screw positions. Give us an inlet and an outlet view, please.
I'd change it anyway.
That's in the joint.
Okay, back out for us for a second.
The plate is now sitting on the bone, and the broken bit of bone is under the plate. And these are the screws that are fixed, holding everything in place. And now we've got complete stability. If I do that, see that it's completely solid, moving as one.
But I never believed anything like this would have ever happened. Most worrying was probably, is she going to be able to walk again? Is she going to be able to get up? Is she going to be able to do things that she'd done before?
Love you.
Love you.
It's 4 days since Harry was admitted to Southampton Hospital's trauma centre after being hit by a motorbike at high speed. He's had 2 complex operations on his legs, but his ordeal is far from over.
Harry, he's quite young, there's a lot going on. He came round in an intensive care environment, so he was awake during, quite a worrying point in his care. It was quite a big psychological challenge and obstacle, really, let alone with the kind of severity of his injuries.
There's a cut in the head, sometimes, badly everywhere. But they will all go if you leave them alone.
Harry has
had a very, very bad accident. He's had sort of abdominal injuries, chest injuries, and a suspected head injury, although it was proven to be non-existent. From the bones point of view, he had much bigger injury than what we had originally thought. The concerning injury was his right shin bone injury, so serious that at a point I was even contemplating amputation. He's got what we call an external fixator, the scaffold which he has externally, which is holding the bones together. He has lost quite a bit of muscle in the leg. They were dead muscles when they came to me in the operation, so we had to take it out.
Heavy. Wow.
Should we rest here? How's that feel?
Harry had minimal power and minimal activation around his right foot, and that was quite a big concern for us.
Yeah, I wonder if you can give Sian some
can we
high five?
Because you're doing so great. Can I have a high five over here?
Oh.
You can't.
Yeah, I saw you do this.
Oh,
good
boy.
boy.
And how about this one, this side?
Yeah.
Great.
Nice.
What about this arm, Harry? Can we do
I just felt so sorry for him, thinking he may have to go through what I went through, and thinking how hard it would be and whether a 9-year-old boy could do it. Retired again.
Good boy, great
Well
job,
done.
lovely.
After his emergency procedure, Peter still needs help breathing with the aid of a ventilator.
No.
He's unable to speak and finds the tube so uncomfortable. He has to be sedated to tolerate it.
I know, Pat. I know. During those days when Peter was sedated and intubated, it was very distressing to see your beloved is alive but not able to communicate with you, and you know that though the situation's stable, you're still far from out of the woods.
At the moment he's a little bit stuck because we can't wake him up too much because he's finding the tube incredibly irritating.
We're sort of at this slight hiatus
I
where we
think
can't
so.
move forward.
I think so. What is important is to get patients awake and moving as quickly as possible because it has a whole number of beneficial effects. And so sometimes in order to move people forward, we move the tube from the mouth to the front of the throat, and that's the tracheostomy. And so by doing that, you're then able to stop some of the painkillers and the sedatives that patients are on. It means they're more awake, it means it's easier for them to communicate, it means it's easier for them to have physiotherapy. Everything we spoke about, everything has risks, but you have to weigh that up against the benefits. You're quite right, any time you make a hole in the skin, you run the risk of introducing infection. The other risk you have is doing anything, again, you make a hole in someone, is bleeding. And the other risk for him is that he's got a fracture in his cervical spine there. Everything in medicine, you're trying to make sure that the benefits of what you do outweigh the risks. And in Peter's case, he had fractures in his neck, which you don't want to make any worse because he hadn't got any nerve damage, and so you certainly don't want to cause any. And so you then have a big decision to make, whether it's the right thing to do to put the tracheostomy in.
It's the question is, we require to extend the neck during the procedure. And if there is likely possibility, if we extend too much, the fracture can press on the spinal cord.
Any surgery carries a risk because of Peter's fractured vertebrae and neck. So, of course, we shed a tear immediately at the thought of the risk of Peter maybe losing mobility or being paralysed. That's a very frightening thing to contemplate.
When you guys are ready, tell me.
You mustn't move his neck at all, keeping him in this neutral position. We've got plenty of length to see his trachea.
Brown solution, please, cleaning. Yeah.
So basically, we have to make a window in the trachea wall in order to insert the tubes.
Give me the mosquito, please. Give me the 15 blade, please. On that.
Challenging part was restricted neck movements because of his spinal injury. Obviously, it was a best team effort with my colleagues, and I was guided by my consultant as well. Overall, everything went well.
With the tracheostomy tube now in his throat to support his breathing, Peter is more comfortable. But he is still unable to speak and is struggling to communicate.
Darling, oh, I'm so glad to see you. Oh, Peter, you've done so well. Well done, my darling. Well done, darling. Oh, that's lovely.
It's 6 days since 19-year-old Shannon underwent surgery to stabilise her shattered pelvis. She's now in intensive care, fighting to regain mobility.
Give me that arm. Can I get you to reach over for this bar? Can we get there? That's it. All right. It's the twisting that tends to be quite sore. So I'm just going to bring you round. Okay. Then we're going to help you sit up, all right? So we'll go ready, steady, and up you come.
Whoa, whoa.
Well done. Well done.
She was really painful.
Yeah. It's just where you're having that weight coming down through the pelvis, it'll be quite sore, all right? We're just going to just sit, all right? Just let it all settle. Do you think you're going to be sick?
Yeah. If I could do anything to take that pain away, I would. It's heartbreaking, absolutely heartbreaking.
We're just going to do a nice slow stand up, all right? So you're just going to take your weight through your legs. I'm just going to come in, just block your knee. That's it, well done.
Oh.
That's all right, you okay? Well done.
No. Go back there. Yeah.
She sees that, right, I've had an accident, I've got to deal with it. The quicker I can deal with it, the quicker I can get on with what I used to do. And she comes back from the physio, tears in her eyes. I said, look, tomorrow's a different day, perhaps it'll be better.
Do you know how long it will be until it stops hurting?
It's hard to say, as long as you've got your pain relief and everything on board. But sometimes the more you do, the easier it gets. Should we try and get to sitting again? Yeah. Okay. So bring this leg forwards, that's it.
Oh, my ow. Can I lay down?
Back on your back,
Very
yeah.
flat.
Don't get disheartened. We'll get there though.
Something her dad always says to her, one step at a time. And that's obviously what she's had on there, and that's what she's going to have to do now as well, one step at a time.
It's just really hurting my back today. It really hurt down my left side. It's annoying.
Following his tracheostomy, Peter's now well enough to receive visitors. His paragliding partner, Barry, was at the crash scene and called the air ambulance.
This is the first time I'm going to see Pete. I don't know what to expect yet, but if I get some response, I should be more than pleased.
Hey Pete, how are you, mate? Good to see you.
So he's a bit of a special character, really, and always amusing. A highly intelligent person. We've been driving to all sorts of paragliding sites all around the south of England. Never run out of conversation. We've always got something to talk about. So he's been a good companion. It's a catastrophic thing that's happened to you, but but you're going to get better. It'll take some time, but you'll get better. I can't hear what you're saying, Pete. I know.
It's okay.
All right, Pete, okay.
Peter's recovery is going to be gradual. People who've been critically ill, they often don't realise quite how sick they were at the time, and then it can get incredibly frustrating why it takes so long for them to get better.
Shannon is making steady progress following surgery on a broken pelvis. She is now stable enough to be moved to a general orthopaedic ward.
Don't think that this is engagement. It's not.
Shut up. Thank you. Thank you. Last. Yeah, I got it. Thank you, baby. Thank you. I love you.
I love you too.
It was like, oh, shock. What's going on there? My husband thought, oh, it's on her ring finger. But no, I knew that he'd bought her a ring for her birthday. Her birthday's due in the next week or so. So it was for that, and it was just beautiful. Absolutely beautiful gesture.
You get like a maternity ring, engagement ring, and then your wedding ring.
So this is like a minor.
Yeah, just a little one. Get a big one. So.
No.
Big rock.
No.
Oh. Okay. Thank you.
You deserve it. You've been awesome.
Together we're going to hold this so that you don't have to move your head at all. And there's the... Hold it as well. Yeah. Once Peter had the tracheostomy put in place, the progress was phenomenal. Increased mobilisation, and with that, this mental recovery was really, really very impressive. And what began to show through, because Peter was now awake, was his own personal determination to make progress. Absolutely evident. Amazing.
And I can't lip read. I'm rubbish at lip reading, so I'll be very grateful when I hear your voice.
Today, the physiotherapist feels Peter is strong enough for a speaking valve to be placed in his throat. It will allow him to talk for the first time in nearly 3 weeks.
What's going to happen? So the trachea goes into your windpipe. It's got a balloon around the outside of it holding it in place. So I'm going to deflate that balloon, and then air is going to be able to pass the tracheostomy and out of your mouth. So if I show you at the moment, if you blow on your hand, you shouldn't feel any air. Can you feel anything? No. So everything at the moment is going into your lungs through the trachea, and then back out of your lungs, out of the trachea. Nothing is coming out of your nose and mouth, okay? So when I deflate the balloon, suddenly the air is going to come up and out of your mouth and nose, and that's going to mean that you can speak because the vocal cords sit above the trachea. The trachea's here and the vocal cords are here. Make sense? Cracking, okay. So day 17 of not having any air circulating in your mouth and nose, so it's going to be quite tickly. So you will have a bit of a cough and a splutter first, but that's normal. Okay? So, little cough come in, all right? So a bit of a cough and a splutter, well done. That's fine, yeah. You might have some coming in. Whoa, good cough. Oh, yeah, you got... That's it. Well done, that's fine. Have another little clear your throat. So is there anything you've been desperate to tell us for the last 17 days?
Oh, there is.
Oh, crikey. OK, we'll keep it clean.
We're not going to go there now.
OK.
I'm so grateful, really, for everybody for what they've done. It's bloody marvellous to get to talk.
Good.
Absolutely marvellous.
Good.
Yeah, it's brilliant to be able to talk.
Yeah.
Without kind of fighting. I had plans for us.
An immediate watershed breakthrough moment when he was able to speak. It's so heartening.
My gratefulness for you to be there at number one. Yeah. But then the loneliness of not being able to communicate and talk and frustration.
Just frustration.
Was outrageous.
It was so difficult. I mean, today for me is a miracle day to hear your voice.
It's now 10 days since Harry was admitted with life-threatening injuries after being hit by a high-speed motorcycle.
Hi Harry, you alright? We were just checking if the wound is healing nicely today. And that's good, it's healing well. How was your other leg doing?
It's broken.
I know, but in terms of how, does it feel okay? Does it?
Oh yeah.
Yeah? Can you stretch your leg out fully? Very good. Can you lift that leg up? That's good. Try doing it without support. I'll help you. Go on then, lift it up. Okay, that's good. Can you hold it there for me? Tighten up these muscles. That's good. Trying. It's good. Very good. Can you see the flicker? Yeah? That means you're trying to tighten the muscle. That's good.
Ready, steady, and stand. Good boy. Wow.
Excellent stuff. Now push up really tall.
Can you tap
those
that?
elbows?
Push those arms down.
Good boy.
Good
You're
boy.
doing brilliant.
Push up through those arms. Good boy.
That's it.
Show us how tall you are.
The progress, I can't believe it. Today, he stood up for the first time in 10 days.
Look at that body.
Those knees are nice and straight. Good boy. Well done, Harry. Really good.
Good boy. You're doing brilliantly.
He was so courageous. He did push things. He did really try. It was painful at times, and Harry did grit his teeth and really dig in, and that's, you know, he's made such good progress because of that. But it was a major incident. So physiotherapy is going to play a major part in Harry's life for quite a while still to come.
Good boy. You're doing brilliantly.
God! How long have you been up then?
Ages.
Next step running then?
I walked out to the middles and floor and back.
Oh, did you?
Yeah.
Oh, mum's off again.
Having a moment.
Oh, look at you. Today it was like a miracle. We walked round the corner and she sat up. She sat in a chair. Oh my God.
Well done.
Well done. Posture. Oh, fantastic. Let me get the picture again.
Right, then your left.
She stood up for us to show us. Then she moved herself back onto the bed, got back into bed. No problem, no help from anyone. That's Miss Independence for you.
Yesterday, obviously, when I sat up and it was less painful, I think that was the first good thing. When you get one little good thing, it really pushes you then.
Look at these photographs I bought of your time when you were in the motorbike display team.
Do you imagine me doing that now? Wouldn't have
fire. Motorbike chick. That's a better one actually. That is.
I was 9 or 10 when I first started. It was pretty amazing and it was very good fun. Bit of a shame that I won't be able to do it now. My pelvis doesn't flex anymore, so there won't be any give, and if I do have an accident, I might just break again. Back in the day,
Yeah.
it's not fair because it's like split-second thing. I could have been on the curb and just unlucky.
Is that all right? No pain? No? Good.
What a wonderful service. What an absolutely wonderful service, and what wonderful people to dedicate all this time and effort to me. It's mind-blowing, actually. Mind-blowing.
I'm going to sit you a little bit more upright in the bed, because you haven't done that yet either.
No.
Here we go.
Look at this.
Hello, sir.
Hey, it's a whole room.
It's a whole room.
No more ceiling.
How does that feel?
That's really strange.
Keep talking to me.
In Peter's case, it was felt that
Still
he
good?
needed to have his spine kept stable. So what we do is the orthopaedic team organise a Boston brace, which is essentially like an external skeleton,
Okay, now I'd like you to hold on to my hand.
so that Peter's spinal column is kept rigid so that he can then be moved while still having spinal protection.
Ready, set, move.
Wow.
Whoa.
You're only blooming sitting up. Well done, Pete. Well done.
Feels so strange.
Put your hands on the edge of the bed.
No, don't let me go yet.
I won't let you go yet.
So unsteady. It's so wobbly.
Any pain?
No,
Good.
sir.
Okay. Now we're going to brace your knees because they're going to be wobbly.
Right.
And I want you to lean forward
Right.
and then stand up.
And then when I'm stood up,
We're just going to stand there and just get used to standing first. Straighten your knees, tuck your bottom in. Tuck your bottom in. You're fine, you're fine. Tuck your bum in. Whoa.
Whoa.
Okay, you're up.
I love paragliding, absolutely love it, but it's probably not in my future. What a dream, hanging around in the middle of the air, free energy, wonderful feeling, wonderful challenge, wonderful focus, wonderful concentration, seeing sights and views that you'd never see before. The easiest thing for me to have done really would have been to die. I wouldn't have any worries, I wouldn't be paralysed, I wouldn't be worried about a wheelchair, I wouldn't be in pain. So in a very real way, that's the easy option.
Coffee.
The difficult options are coming out of it. And then you realise how precious and how fragile our lives are and how fleeting. Well, my relationship with Jill is much stronger. It's deeper. It's an appreciation of this person who sat by my bedside for 3.5 weeks, who moved to Southampton to be beside me every night and every day. I don't know how I would have coped had Jill not been there.
What Peter does in the future in the way of hobbies and more adventurous sports, that's something only he can decide. But I'm hoping we can take up something a bit gentler like hill walking.
Trauma happens in a sudden, unexpected, unanticipated, often undeserved way. It's that sliding doors moment. Maybe if something had just been a little bit different, their lives wouldn't have been changed forever.